Hi, I'm Brittany Bragelman. I'm the Physical Therapy Manager at Rejuv Medical, and today we're going to be talking about exercise and pregnancy. We'll be giving you a couple of easy exercises that are simple to do, are quick to do, and can help you during your pregnancy.
I'm Angie Jokey. I'm the physical therapist assistant here who will be demonstrating the pregnancy exercises, and I am in my third trimester.
So a couple things we just want to review before getting started. While you're pregnant, this is not the time to start a new exercise routine. So for example, Angie has never been and will never be a runner.
No.
So it's not the time to start running. Things you also want to avoid, you don't want to do any contact sports, so football, high impact activities, you don't want to go downhill skiing, things like that. But if you had been a runner and you want to continue running, as long as your doctor okays it, you're more than welcome to continue doing that. Other things to be careful of during pregnancy, you want to make sure you don't overheat and make sure you drink enough fluid. If you don't listen to your body and if you don't respect those things, it could lead to negative consequences down the line. So the first thing we're going to talk about is posture. So oftentimes when you start to carry more weight in your belly, the baby's up front, you start to, what Ange is showing here, you start to get this increased arch in your low back. What we want to make sure is that you don't hang out like this because that can be a lot of pressure on your back. So the first thing we want to do is teach you how to draw in your lower abdominals and improve your posture. So what Angie's going to do is she's going to try to draw in her lower abs, try and tuck her butt under her a little bit. What you can do, you can hold that and you can do about 10 repetitions of those, and frequently throughout the day would be a good recommendation. What we'll do in just a minute, we'll show you some different positions that you can do as well. But specifically, if you're going to be standing somewhere for a long time, make sure that you're using your abdominals, engaging your core, and not just hanging out like this. So another thing that when you're sitting, so if you have a desk job, oftentimes you're very slouched forward, you have the arch going this way in your spine. So what we want to do is work on sitting posture as well. If Angie goes up and tries to just get into good posture, she has a slight arch in her back. What you can do as an exercise is work on the two extremes. So you can really arch your spine, tilt your pelvis, and then you can do the opposite, kind of rock back. And that's just going to keep that pelvis and that low back nice and mobile. So go ahead and just do a couple more, and back, and up, and back. So again, 10 repetitions of those frequently throughout the day will keep things mobile. So the final position to work a little bit on pelvic positioning or pelvic rotation is in what we call quadruped, so hands in your knees. Oftentimes this feels really good to just let your belly hang, let the baby's weight be there rather than on your spine. So again, Angie's showing that extra arch here. What we want to learn is to learn where what we call spine neutral is, so right in the middle. She tries to draw in her abdominals in order to flatten out her spine and stay straight here. What we don't want is the other extreme and kind of rounding up. That'll be a different exercise which we'll go through, but we want to make sure that you can stay nice and flat. So go ahead, go down, and keep everything nice and level. Keeping that spine neutral is going to decrease the forces on your low back, which eventually, or essentially, will decrease low back pain. So another exercise to keep the spine moving and can feel really nice to do this sort of stretch is a yoga move, and it's called cat camel. So what you do, you start in neutral here like Ange is doing, spine is nice and straight. You're going to arch your back. This is called the camel portion. And then the other part coming up, called a cat. You want to think about stretching, nice long stretch through that spine, and then dropping down. And see how Angie's looking up, and then again coming back up, rounding through there, real nice stretch through the low back there. You can do about 10 to 20 of these one time a day. So the next stretch is another modified yoga pose called the prayer stretch. Now typically when you don't have the belly, you're able to kind of reach straight forward. What Ange is going to do is she's going to kind of bring her legs apart a little bit, make room to bend forward, extend out those arms, try and flatten the chest as much as possible against the table. Feel that stretch through the low back here. Now at a certain point you may not be able to do this anymore, and we'll show you another option. But this one you can hold for about anywhere from 30 seconds to a couple minutes depending on what you need and what you feel. So the other option, if it's not comfortable kneeling and kind of getting down on the floor, you can just go to a table or you can go to a counter height, put your hands at the edge, and just let your bottom lean back, your chest fall down, and try and get that stretch through the spine. So this is much, much easier just to do this anywhere during the day. So at work, at home, wherever you are, you don't have to get on and off the floor. Really easy, couple minutes, 30 seconds to a couple of minutes, one time a day at the minimum. Our world brings us into this position, whether we're eating, texting, typing. So oftentimes the chest, the front of the chest gets very tight as well. So we want to make sure to stand upright. That's why we're working on posture. An exercise to help stretch out the front of the chest is a pec stretch. What you can do, pretend Ange is in a doorway here. So we've got the door frame there. She's going to put her arms on the doorway and she's going to do a little bit of a lunge forward to really stretch that chest out. So again, door frame as she comes forward. You want to hold that for about 30 seconds and then you'd come back. And I want to feel it here, right, Brittany? Correct. Across the front of the chest, the front of the arms, and then you would do another repetition. So you hold for 30 seconds and you do 2 repetitions, minimum time, 1 time a day. A stretch to help open up the hips is called the butterfly stretch. So what Ange is doing, she's putting her legs out, her feet together, and essentially what she's going to try and do is just kind of press down on the top of her legs to stretch out the hips and stretch out the groin as she leans forward a little bit. You can hold for about a count of 30 seconds again and do 2 repetitions. So in general, when you're doing a stretch should be held for anywhere from 20 to 30 seconds for 2 to 3 repetitions. So accumulation wise, you want to do a total of a minute stretch. Whether you do 20 seconds and do it 3 times, 30 seconds twice, no big deal, but just make sure you're holding the stretch long enough to have some sort of positive benefit from it. Really important to keep the muscles down the spine nice and strong. What Ange is going to be doing first, like we practiced already, you're going to try to keep that spine neutral. So you're going to try and stay nice and flat. She's going to lift her right hand or her right arm out as she slides her left leg out. Now what you want to make sure not to do, and I'm going to have Angie do this poorly, you don't want to have an increase in the arch in your low back. So go ahead and show that. So this would be bad. You want to make sure that you're staying nice and flat as you extend out. Now she would come back to the start and she would alternate. So this time, left arm, right leg, and back. Again, trying to stay flat here, not letting the back arch too much. You'd want to do about 10 repetitions on each side, so 20 repetitions total, 1 time a day. A good exercise to keep your butt nice and strong, keep your hips level and your pelvis stable is called the clamshell. What you do is you lie on your side, you have your knees bent, you keep your feet and your ankles together as you open this top leg up and down. Now important here, when you're doing this, go ahead and do a couple for us, Ange. You should feel the muscle working back in your butt. You should not feel any pinching at the front. You should not feel any low back pain. A common compensation that we see people do is they roll their entire body back. That's not what we want. We want to make sure that this part of their body stays forward as they lift that top knee up. I tell people that this exercise, the goal of it is not to try and lift the leg as high as you can. The goal of it is to try and make sure you're feeling it in your butt muscle, in your glute muscle. You'd want to start out doing about 10 repetitions of this, slowly work up to 40 repetitions 1 time a day. So this muscle, it's an endurance muscle. We want you to do high repetitions with no weight. So 40 reps would be the goal, and you're going to feel a good burn by the end of that. The next exercise is called a donkey kick. This is again working on glute strengthening and glute muscles. Ange is going to be in that quadruped or hands and knees position. She's going to try and keep level spine, so neutral pelvis, as she kicks one leg back. Good, and down. Again, as you're doing this, make sure to keep that spine nice and level, that pelvis straight. What we don't want on this next one Ange is going to show us is we don't want to increase the arch in the low back here. That's going to contribute to low back pain, and we're trying to minimize that. So do a couple more good ones for us. Same as with the clamshell prior to this, we want to start out with about 10 repetitions, working up to 40, one time a day. And you would do this on both legs as well. So you get done with one side, you can move to the other. So again, one set of 40 repetitions, one time a day. Another muscle group and action that you really want to keep strong is squatting. You're going to be squatting down to get the baby on and off the floor. If you have multiple children, you're going to be getting your toddler on and off the floor. So what you can do is we want feet wider than shoulder width apart. We actually want toes turned out a little bit. We're going to do what's called a sumo squat. That makes more room in the hips and more room for the belly. What Angie's going to do is she's going to have that wide base of support. She's going to squat down, keeping her chest up nice and high and up. So this will strengthen quads, this will strengthen glutes, this will keep you nice and strong so you can get on and off the floor and be able to play with your kiddos. One way you don't want to squat is you don't want your knees to come in front of your toes. So what Ange is showing there, her knees are coming in front of her toes, what she wants, and she's staying very, very upright. That puts a lot of pressure through your low back. Go ahead and stand back up, Ange. What you want to make sure you're doing is when you squat down, you're sitting your butt back, keeping your knees behind your toes. So knees are behind your toes here. She's getting her butt back, which is going to get her glutes. This is much, much better for your knees, much better for your low back. What you want to do in terms of repetitions for this one, same thing. Start out with about 10 repetitions, work up to about one set of 40, one time a day. One more exercise to help with the leg muscles that'll help you recover quicker and be able to play with your kid as they get bigger, or if you have toddlers, is a lunge. So what Angie's going to do is she's going to lunge 1 foot forward, 1 foot back, and she's just going to drop down. This is going to strengthen your quads, your hamstrings, and your glutes. Make sure that you have good balance with this, that you're not leaning one way versus the other. You want nice upright posture in order to make sure you're not going to injure yourself doing this. What we don't want to happen when you're lunging is we don't want your knee to go in front of your toe. So Anna's just going to show us a bad version. So she's lunging forward. Her knee is out in front of her toe. What you want to do is we just want to think about dropping down into your lunge, keeping equal weight on your front leg and your back leg. So 50% on the forward leg, 50% on the back leg. In terms of repetitions with this one, same concept that we've been talking about with all the strengthening exercises. Start out with about one set of 10 repetitions, working up to about 40 repetitions, one time a day. One thing that you can develop during pregnancy is called a diastasis recti. What that means essentially is the middle part of your abdominals, that fascia, comes apart. Essentially, your rectus abdominis or your ab muscles come apart. If that happens, you do not want to be performing a crunch, so a traditional crunch. You do not want to be doing that because that's going to make that diastasis recti worse. One exercise to help during that process, and especially postpartum, is you put one hand across your belly, the other hand across your belly. You almost want to give your belly a hug. So you want to approximate, you want to bring those ab muscles together first, and then you can perform your crunch. What I would not want Ange to do is just your traditional sit-up or your traditional crunch without squeezing her belly. If your hands can't reach apart, it's sometimes nice to take a towel or a belt under the body and pull them across with your own hands to keep those abs together. Then you do your crunch. So again, if you start to develop that, if you notice a little pouching down the center of your abdomen, then do not perform any traditional sit-ups or crunches. And you certainly can talk with your physician about this too if you have questions about a diastasis recti. Thank you for taking the time to listen to us today, and hopefully we gave you a couple of tricks that can help you stay active and pain-free during your pregnancy. If you have any questions, feel free to call Rejuv Medical at 320-217-8480. You can schedule an appointment with one of our physicians. You can schedule an appointment with any of our physical therapists. We'd be happy to go over these with more detail and specific to what you're looking for.
And again, congratulations and welcome to a new journey.